Hello, everybody. Hope that you're doing well. Welcome back for another RT test tip. Now, I'm a couple days past Tuesday. Uh, I apologize for that. I had some issues that didn't allow me to be able to post on Tuesday, but I do appreciate the individual reaching out for more of these that asked for it. So I'm glad to know that you guys are watching them and finding them to be helpful. So the question I wanted to go over today, kind of to help out my first year students a little bit, but nonetheless, hopefully you can find some benefit from it too. The question itself asks, with which of the following would oxygen diffusion impairment most likely be evident in a patient with a thickened alveolar capillary membrane or with thickened alveolar capillary membranes? Then we've got the answer choices A, B, C, and D in a prone position at rest, and a supine position at rest, semi-Fowler position at rest, or during exercise. So while the answer probably should be pretty evident, let's kind of talk about the thought process that should go into this. So we are looking at the question of itself. We're talking about an oxygen diffusion impairment, and we know that the alveolar capillary membrane is thickened. So I have on the screen kind of drawn an alveolar unit with a capillary bed going past it, and then I've drawn another alveolar unit with a thickened alveolar capillary membrane, and we'll talk about that here momentarily. But nonetheless, if you think about blood flow through the heart, we know that blood returns to the right atrium. Deoxygenated blood returns to the right atrium by way of the superior inferior vena cava. Then you're going from the right atrium to the tricuspid valve into the right ventricle, up through the pulmonic semilunar valve into the pulmonary arteries. So the deoxygenated blood is going through the pulmonary arteries, down through the arterioles, and into the capillary bed, and all that's carrying your deoxygenated blood. And then, so if we're running along this side, so this would be coming from the right side of the heart, deoxygenated blood. All those deoxygenated is carrying carbon dioxide, and it's important to understand that. Uh, Alveolar capillary membrane thickness is going to play a role in the ability of those gases to transfer back and forth across the alveolar capillary membrane. So, nonetheless, we've also covered a few laws concerning diffusion. So we started out with Fick's law of diffusion. We also talked about Graham's law and Henry's law, and we'll provide the application for those here momentarily. So we do know that not only does alveolar capillary membrane thickness going to play a role with that, pressure gradients will play a role with the ability of the gases to diffuse as well, and membrane surface area is going to play a role. And if you understand Fick's law of diffusion, you know that all three of those components are factored into that. When we take into account Graham's law or Henry's law, we can mathematically go through the solubility coefficients to determine the speeds really at which oxygen and carbon dioxide diffuse across those membranes, or the medium that those gases will diffuse quite a bit better, more quickly, what have you. And so, with going over those solubility coefficients, we understand that carbon dioxide actually diffuses across that alveolar capillary membrane roughly 20 times faster than oxygen does. So, when we set things up for the overall ability of and ultimately, if you think about the deoxygenated blood, or that side of the arterial side of that capillary bed that's carrying that deoxygenated blood, which is CO2 rich. We know that CO2 needs to come out of the blood and move into the alveolus so that when we exhale, we can blow that CO2 out. We also know that when we breathe in, we're taking in a composition of room air, which is roughly 21% oxygen, 78 to 79% nitrogen, with a small percentage of other trace gases that we may be breathing in. But the piece that we need for survival is that 21% oxygen. So we know when that oxygen comes in that it needs to get into the bloodstream. Well, how does CO2 come out of the bloodstream into the alveoli, and how does oxygen come out of the alveoli and into the bloodstream? Pressure gradients. Uh, so remember, a couple of weeks ago we talked about how we move air in and out of the lungs, and we established that it is the ability of the diaphragm to contract, so to speak, to help, not so to speak, to contracts to help change that those pressure gradients. So ultimately, we also understand that things will diffuse, or ventilation will occur across a pressure a pressure grade, so downgrading, if you will, so from an area of high pressure to low pressure, high concentration to low concentration. So keep that in mind as well. So in our uh, arterial in the capillary bed where we have that deoxygenated blood, that CO2 rich yet deoxygenated blood, the partial pressure of CO2 is higher in the blood than it is in the alveolus, which is going to allow that gas to diffuse across that alveolar capillary membrane so that we can exhale that out. So higher pressure in the blood than in the alveolus allows that diffusion of CO2 across that alveolar capillary membrane into the alveolus so that we can exhale it out. When we breathe in, we've already talked about, and you can calculate your partial pressure of oxygen at sea level or at any given barometric pressure. You take that barometric pressure, multiply it by 0.21 to get your partial pressure of your oxygen for that. We also understand we're taking away once we inspire that oxygen, water vapor pressure and so forth. We talked about the oxygen cascade. So ultimately, we get into that sweet spot of about 80 to 100 millimeters uh, of mercury uh, of PO2 within our bloodstream. So your alveolar pressure is going to be a little bit higher than so. Notice that P capital AO2 is your alveolar partial pressure of your alveolar oxygen. P with a lowercase a is the partial pressure of your arterial oxygen. Your alveolar pressure is going to have to be higher than your arterial pressure for that oxygen to move based upon pressure gradients for that oxygen to move from the alveolus and get into the bloodstream. So we do have the going back to the uh, rate of blood flow, deoxygenated blood returns to the right heart. Right heart sends blood into pulmonary circulation where this diffusion is going to take place. And then that oxygenation is going to be sent. That oxygenated blood gets returned to the left heart and then out to the rest of the body so that those items can be replenished. Uh, so with that being said, we have to look at the transit time for that blood movement across that alveolar capillary membrane. So when we look at the overall transit time, so we're looking at roughly 3/4 of a second or 0.75 seconds for that blood to diffuse across. Within the first quarter of that second or 0.25 seconds of that time frame, you have oxygen reaching equilibrium. So you've got the oxygen diffusion across into the bloodstream, and that happens early on in the 0.25 seconds. So as that blood's moving along, it has the oxygen, and because those pressures have equilibrated, there's not any more oxygen diffusion that is occurring. That oxygen moves on and can go to the left side of the heart and be sent out. So understanding that, uh, when we take into account the oxygen diffusion and the increase in alveolar capillary membrane, because we're looking for that equilibrium to occur as long as the patient is at rest and not exerting themselves, we can see that you will eventually acquire that oxygen equilibrium and have the appropriate amount of oxygen. And so at rest, the patient um, should not experience any significant hypoxemia or what have you. But not to say that they may not be hypoxemic, but they should not be problematic. They should be able to be physiologically okay at rest. The question in part talks about when would an oxygen diffusion impairment most likely be evident in a patient with a thickened alveolar capillary membrane or with thickened alveolar capillary membranes. So what happens now is when this patient is at rest, because of everything that we've talked about and the ability of oxygen to reach equilibrium, as long as that transit time is appropriate and at rest, that oxygen should hopefully diffuse across, and those individuals are not going to be um, uh, should not have an increased work of breathing or what have you because of the need for additional O2. What will happen is with exercise, when you exercise, you become tachycardic, you become hypertensive. So heart rate goes up. When heart rate goes up, that transit time is actually going to get shorter because blood flow is going to be moving much quicker around that alveolar capillary bed. So therefore, the blood may be moving so fast that the O2 never has a chance, as great of a chance for equilibration to occur. So you're going to have blood that did not pick up as much oxygen as it should going past that alveolar capillary unit. So it's not as saturated, if you will, as it should, or doesn't have the appropriate pressure of oxygen that's going to be available to satisfy our body's demand. So there, you're going to have a situation where the patient's going to get very short of breath. They may become uh, hypoxemic during exertion. And I think back to when before my mother passed away, she truly this desk that I'm sitting has probably roughly 5 feet, 5 or 6 feet. She truly could not walk the length of this table without looking like she was getting ready to have a coronary event, turning blue and this and that. And given the lung diseases that she had and so forth, she did have some thickened alveolar capillary membrane issues. So hopefully the explanation was probably maybe a bit much than what you needed for the question, but hopefully it helps the concept of oxygen diffusion impairments. So we talk about oxygen diffusion being perfusion limited, uh, but in the presence of an alveolar capillary, thickened alveolar capillary membrane, the issue really is going to become diffusion limiting because we're not going to be able to those pressures aren't going to be able to equilibrate. So D would be the best answer choice here. So during exercise is when those oxygen diffusion impairments are going to be most likely evident with a patient that has a thickened alveolar capillary membrane. Thank you for your time and attention. I hope you have a good day.